Good day everyone, my name is Annabelle. Together with my group members Kathleen, Patiban, Hazika and Zulaika, we will be presenting about the main aspects of complementary and alternative medicine and hopefully raise some awareness about it. Complementary and alternative medicine, or abbreviated as CAM, refers to medical products and practices that are not typically considered to be part of mainstream or conventional Western medicine. Complementary medicine is using a non-mainstream approach together with conventional medicines. Acupuncture is one of the components of traditional Chinese medicine. Acupuncture involves the insertion of very thin needles through your skin at strategic points called acupoints, which present in all of your body. Acupuncture is most commonly used to treat pain, aside from being used for overall wellness, including stress management. Traditional Chinese medicine practitioners believe that human body has more than 2,000 acupuncture points connected by pathways or meridians, where each of these acupoints corresponds to a specific organ or limb. By inserting needles into specific points along these meridians, acupuncture practitioners believe that your energy flow, also known as qi, will rebalance, thus improve health. Alternative medicine is using a non-mainstream approach in place of conventional medicine, following a special diet to treat cancer instead of cancer drugs prescribed by oncologists is an example of alternative medicine. People who have chronic conditions that are difficult to treat are more likely to use complementary and alternative medicine methods.
My name is Nazika binti Harun. I will explain about the elements and components of complementary and alternative medicine. First, the whole medical system is one of the components, which is a complex system that includes a defined philosophy and explanation of disease diagnosis and therapy. Whole medical system involves complex system of theory and practice that have developed independently apart from and earlier than allopathic conventional medicine. Many are traditional systems of medicine that are practiced by individual cultures throughout the world. They included Ayurveda, homeopathy, naturopathy, and traditional Chinese medicine. Second, mind-body medicine uses the power of thought and emotion to influence physical health. Behavioral, psychological, social, and spiritual methods are used to preserve health and prevent or cure disease. Because of the abundance of scientific evidence backing the benefit of mind-body technique, many of the approaches are now considered mainstream. As an example, meditation, yoga, and imagery. These techniques are also used to help people cope with disease-related and treatment-related symptoms of cancer and to prepare them for surgery. That biologically based therapy use naturally occurring substances to affect health. It includes dietary supplements and herbal products. This therapy involves substances such as herbs, vitamins, dietary supplements, and foods to treat illness and enhance health. It commonly used the most controversial modality of complementary and alternative medicine. Fourth, manipulative and body-based therapies treat and heal various conditions through bodily manipulation or movement of one or more parts of the body. Manipulative and body-based practices focus on the structures and system of the body, including the bones and joints, the soft tissue, and the circulatory and lymphatic system. These therapies are based on the belief that the body can regulate and heal itself and that its parts are interdependent. It may be used to treat pain, stress, anxiety, and depression, and for general well-being. These therapies are thought to stimulate the body's energy and to enable toxins to leave the body. Examples include chiropractic treatment, physical therapy, and massage therapy. Energy medicine is the therapy that focuses on the energy field thought to exist in and around the body called biofield. This therapy also encompasses the use of external energy sources called electromagnetic field to influence health and healing. Energy therapy are based on a core belief in the existence of a universal life force or subtle energy that resides in and around the body called vitalism. It directs and intensifies life energy called qi to make the body stronger. Practitioners of energy therapy typically place their hands on or near the body and use the energy to affect the energy field of the person. Therapeutic touch, healing touch, and Reiki are probably the most commonly used as example of energy healing.
Hello, my name is Parthiban and I would like to talk about the potential of complementary medicine becoming mainstream. Talking about the present developments in complementary medicine will cause disagreements among many because of the treatments are commonly described in terms of fixed historical heritage left in a bygone era. Few people who are familiar with alternative medicine, however, would challenge the recent significant changes to both its organizational structure and scientific foundation. These changes can be a sign of increasing integration of complementary medicine. The term integration as used here refers to the application of comparable clinical, scientific, and regulatory standards throughout all domains of healthcare. There would likely be no mention in the historically contested notions of conventional and complementary medicine if a list of what matters to the patient, researchers, doctors, and consumers were to be compiled. Integration obviously affects how readily available and accessible healthcare is. In order for the patients to believe that they are receiving care as part of a coordinated service, clinicians should play an important role in the integration of complementary medicine. There are a few indications that complementary medicine is integrating more and more. First, the quality and amount of practical research in alternative medicine are both rising very quickly. For an example, a Cochrane systematic review of a herb St. John's wort for mild to moderate depression included 27 trials with a total of more than 2,000 participants. The review found that St. John's wort was superior to placebo and equivalent to the tricyclic antidepressants, but had fewer adverse effects than the normal medicine. Many complementary medicine treatments are well supported by evidence. Furthermore, some complementary medicine therapies are advised by guidelines and consensus statements released by conventional medical organizations. For an example, acupuncture, hypnosis, and relaxation techniques are used in the guideline on the management of pain associated with cancer that have been published by the US National Comprehensive Cancer Network. Other than that, osteopaths and chiropractors lately becoming the first practitioners of complementary medicines to be regulated in the United Kingdom. Furthermore, the emergence of evidence-based medicine is one reason why conventional health professionals have a more accepting attitude towards alternative medicine.
Hi everyone, my name is Laika and I will add a little bit on complementary and alternative medicine. As you all know or may not know, conventional medicine is the most common type of medicine in the Western world. Many types of complementary medicine has been around for hundreds of years. However, it is only in the last few decades that the doctors have started to use complementary medicine alongside conventional treatment. One key difference between CAM and mainstream medicine is the strength of evidence supporting best practice. Mainstream medicine, when possible, bases its practice only on the most conclusive scientific evidence, and in contrast, CAM bases its practice on evidence-informed practice, where practice based on the best evidence available, even when such evidence does not meet the highest, strictest criteria for efficacy and safety. However, some CAM practice, including the use of dietary supplement, have been validated by traditional scientific criteria. Moreover, people use conventional medicine to prevent, diagnose, and treat symptoms and conditions. Doctors may use complementary treatment to alleviate side effects of conventional medicine and improve the person's overall quality of life. For example, a person may use complementary treatment to reduce stress, balance emotion, and alleviate fatigue while undergoing chemotherapy. In 2020 study from trusted source, investigated the use of chem treatment for people with fibromyalgia, where 2/3 of the participants used chem treatment, with the most common therapies being vitamin, medicine, and massage therapy. The researcher also found that people who use chem treatment alongside pharmacological treatment has significant higher quality of life than those who only use conventional approach. How do healthcare professionals use them together? A coordinated treatment approach that combines conventional and complementary medicine is known as integrative health. Integrative health aims to heal each person and maximize their quality of life by treating their physical, mental, and emotional health. Individual needs will determine the best combination of therapies. Traditional healthcare professionals such as doctor, nurse, and therapists can work together with complementary therapies to create treatment plan. This plan can treat all aspects of person instead of focusing on one area of the body.
So, do you guys know what other type of health benefit do complementary and alternative medicine approaches provide? Each type of complementary medicine may target a specific aspect of your health. In general, complementary approaches may provide one or more of these health benefits. It can relieve pain, reduces anxiety and stress, reduces nausea, improve mood, increases relaxation, improve wound healing, encourage feeling of well-being, pleasure, positivity, and inner peace, relieve muscle tension, decreases tightness, and improve flexibility and circulation. But only by taking or doing a different type of complementary and alternative medicine can only giving you for all the benefits that I have mentioned just now. So, for example, the benefits of acupuncture is it can help to relieve sickness caused by some chemotherapy drug, or it can help relieve a sore mouth after having treatment for head and neck cancer. Acupuncture can also help to relieve pain after surgery to remove lymph node in the neck. The second example is Ayurveda. It can help to reduce anxiety and stress by doing practice of yoga, meditation, breathing exercises, massage, and herbal treatments, allowing the body to calm down, detoxify, and rejuvenate. Last but not least, by doing yoga, it can improve the autonomic nervous system, making your mind alert so you can focus well and stay energized throughout the day. Breathing exercises help infection at bay and allowing abundant oxygen supply to the cell to create a sense of awareness. Depression and anxiety can be treated with Shirodhara Abhyangam, Shiro Abhyangam, and Pada Abhyangam. So, as a conclusion, for this complementary and alternative medicine, there are sufficient number of study in some area, despite claim often heard about the lack of evidence for complementary and alternative medicine. A lot of research that has been done in this field, and new drugs for treating more illness are being explored by the side effect and resistant allopathy. Drug is becoming a new human concern. So people nowadays are turning to alternative approach. So the prospect for alternative approach is bright.